Welcome to the Health Trip Podcast. My name is Jill Foose. I'm a functional medicine and integrative nutrition health coach. I created this podcast to bring you along as we travel down intriguing, science-packed roads, debunking old medical paradigms and perusing new innovative therapies and modalities with the finest functional medicine doctors, practitioners, and like-minded biohackers while living our best life. Enjoy the show. Hi, everyone, and welcome back to another episode on the Health Trip Podcast. Testosterone therapy for women is often misunderstood, yet it plays a crucial role in overall well-being, including our sexual health, our energy levels, and our cognitive function. And as women age, testosterone levels naturally decline, contributing to symptoms like low libido, fatigue, mood changes, and loss of muscle mass. While estrogen and progesterone receive the spotlight in menopause discussions, testosterone is equally as important for maintaining our vitality. Properly dosed testosterone therapy can improve sexual desire and arousal and satisfaction while also enhancing our bone density, mental clarity, and overall motivation. Despite these benefits, many myths create hesitation around testosterone therapy used for women. In reality, side effects only occur with extremely high doses. When properly prescribed, testosterone therapy helps restore natural balance without unwanted changes. And many women assume estrogen therapy alone is sufficient in postmenopause, but testosterone plays a unique role in sexual function and energy that estrogen cannot fully replace. And by debunking these myths and understanding the science-backed benefits, women can make informed choices about their hormonal health and their overall wellness. Lastly, this episode will shine a light on other modalities that may help women restore their arousal, desire, vaginal health, and function. It's a woman's right to a fulfilling and pleasurable sex life that lasts well into her senior years. My guest today is Dr. Sarah De La Torre, a double board certified physician with over 25 years of experience dedicated to advancing women's health. A seasoned OBGYN, she has delivered over 4,000 babies, performed countless surgeries, and guided women through every stage of their health journey. Her passion for empowering women led her to expand her expertise into hormone optimization, functional medicine, and lifestyle-based care. Beyond her clinical work, Dr. Sarah has shaped the future of women's health through media, product innovation, and education. She serves as the clinical lead for Respin Health, founded by Halle Berry, which has contributed to women's health advancements with Joylux, and is a clinical faculty member of the University of Washington School of Medicine. Dr. Sarah is passionate about empowering women to understand their bodies, confidently navigate perimenopause and menopause, and advocate for their well-being at every stage of life. Just a short medical disclaimer before we dive in. By listening to this podcast, you agree not to use this podcast as medical advice or to make any lifestyle changes to treat any medical condition in yourself or others. Consult your own physician for any medical issues that you may be having. And this entire disclaimer also applies to any of my guests on my podcast. So sit back, open your minds, and let's dive into the science around testosterone. Hey, Dr. Sarah, welcome to the Health Trip Podcast.
Hi, Jill. Thanks for having me. I'm so excited to be here.
Yeah, I'm really excited to have you here too, because, we've been shining the light on estrogen and progesterone, and women are finally just settling into this conversation, becoming open-minded about hearing the science, opening up the door to a conversation with their OBGYN or their primary care physician, and just sort of chatting about it. But testosterone is equally as important, and it's sort of like this hormone that has been sort of off the table for a while. And I want to bring it forward, and I want to make more women aware of this amazing hormone. And who better than to have on to share the expertise on testosterone than you?
Thanks, Jill. Well, you're so right. And estrogen, I'm so happy that estrogen and progesterone are finally menopause hormone therapy. We're finally talking about, we're finally getting more comfortable. We're refuting the data from the Women's Health Initiative, and women are considering hormones, because as you and I both know, they can be life-changing and incredibly altering. And testosterone's part of that picture, right? It's a very vital hormone that we have. Women or people just tend to think of it as a male hormone, or it's just all has to do with men or males, and it doesn't. It has a vital role in our body. It protects our brain, our bones, our reproductive function. It's present, from a very early age in puberty, and it has a very important role in terms of ovulation, in terms of metabolism. So I'm a huge testosterone fan and proponent. I add it to most women's hormone therapy regimen when they see me as patients. So I'm glad we're talking about it.
Yeah, I think that a lot of women don't even know that we have testosterone in our body. They think they immediately go to the gym and they think of, the Arnold Schwarzeneggers of the world who are just pumped up and jacked up, and that's what testosterone stands for. And so, what is it about that specific visual that is scaring women away from using it?
Well, I think what women, well, they also think about acne and hair growth and
Yeah.
things like that, like all these male attributes or masculinizing attributes. But testosterone, we have more of it in our bodies than we do relative to estrogen and progesterone. And it declines with age, as do estrogen and progesterone. But it leads to lots of good things. Our sex drive, our muscle mass, our bone health. It's really important in bone metabolism. And so I think culture has made testosterone this aggro hormone, right? And that's just the way it's been treated for men. Men have low testosterone as well, but it's sort of, hyper masculinity is the association. And that's just not true. Even though we have more of it in our bodies relative to estrogen and progesterone, we have incredibly less amounts than men. And we sometimes, and we'll talk about this as we get into replacement therapy, is that we just need a little bit oftentimes. Sometimes we need a lot, but sometimes we just need a little touch of it to feel better, to have our brains functioning better, our mood better, our sex drive back. So again, it is vital. And culture has kind of made it this hyper masculinizing thing.
Yeah. Let's circle back on where testosterone even comes from. I think it's always important to help women understand how their bodies are working and how all of these hormones are even coming to fruition in the first place. Because, as you know, testosterone is made in the ovaries, which you'll talk about, and it converts to estrogen. Women just think, oh, our ovaries just jump
Right.
right to estrogen. So, take us on a tour of testosterone.
So testosterone comes from a few different places in our body. The ovary is one place, and in younger women, there's about 25% of our testosterone from the ovary, and then 25% from our adrenal glands. So our adrenal glands is sort of our hormone synthesizing place. We start with cholesterol, goes down these various pathways to progesterone, to testosterone, and to estradiol. And then something called our peripheral tissues, so in our fat tissues and outside of those reproductive organs in our adrenal glands, we create estrogen from testosterone. That's called peripheral conversion. Testosterone also goes to something called dihydrotestosterone, which I hope we touch on today because
Yeah.
that can have some significant side effects in women and men as well. So we have testosterone produced in essentially three places: our ovaries, our adrenal glands, and our peripheral tissue.
All right, let's talk about some myths before we get into the nitty gritty of testosterone replacement therapy. One of the myths and misconceptions that we're sort of touching on is that testosterone is only for men and that it'll make women masculine. I've always heard from doctors that if you give a woman testosterone, like for example, her clitoris is going to become enlarged. So I want you to really break this down for women.
Right. I think there's a lot of fear. Um, Certainly in conventional medicine, certainly the way I was trained. So, I'm in my 50s. I've been an OBGYN for a very long time. And much of the rhetoric as I was, coming of age is like never testosterone in a woman, never, never, never. So if she has low libido, well, that's just the way it goes. And I've certainly, and I don't think conventional medicine is quite getting there, but it's starting to move in that direction, that the importance of testosterone in women is really important. So again, if you think about the relative difference in the amount of testosterone in a man's body and a woman's body, if you are just slightly increasing a woman's testosterone level, she's not going to get an enlarged clitoris. She's not going to have hair growth. She's not going to have acne. It's when we do what's called super physiologic doses, much higher than what a woman requires. Of course, there will be side effects. And I think most people who are giving testosterone are following, most clinicians are following their patients closely, are looking out for side effects and counseling about them. But no, and androgen therapy, testosterone therapy should not masculinize a woman if it's kept in the appropriate range. And the thing about muscles, which I love, so when we were growing up, Jill, I feel like everybody wanted to be skinny and muscles were kind of like not the thing. And now, thankfully, we know that muscles are so important and they're becoming more attractive, to culture where women look, more appealing when they have muscle mass. So a little bit of muscle mass as we're aging, because we lose so much muscle mass, I think is a great thing. And we're not talking about these huge muscles, but maintaining muscle tone and maintaining your muscle mass as you age is actually very important.
Yeah, and I would like to add there that just using testosterone therapy is not going to give you muscles. You're not going to wake up the next day and look like Popeye. Like it's just not going to happen,
Not going to
right? You
happen.
still have to do the work. You have to eat optimal amounts of protein. You have to get into the weight training room and actually lift weights and stimulate the muscle growth. So, a lot of women fear, like you said, taking testosterone because they think they're going to turn into Popeye, but it's just not so. And here's a personal story. When after I had my fourth child, so this is back in 2000, my ovaries basically stopped producing testosterone.
Oh,
And I
wow.
actually had to be put on synthetic testosterone because back then there was no option. We didn't have the plethora of options that we have today. And so I did. It was an oral form of testosterone. And even back then, it didn't turn me into a more masculine female. I went on to have another baby. My clitoris did
Mhm.
not become enlarged. I did not have hair on my face. I was using a very small dose. But back then, the importance of it in terms of the quality of my life, raising four kids and then going on to have a
Right.
fifth was huge. Eventually, I switched over to what we're using now for women. But, this is going back 25 years for me now.
Right. Yeah. So if you think, we have a lot of data from the transgender community of testosterone being very safe, right? Very safe,
Yep.
causing breast cancer, helping with bone. And so that's the other part of it is this, that women are scared of the side effects of acne, hair loss, or hair growth on your face, and then clitoromegaly, things like that. But we have a lot of data on the safety of it in terms of breast cancer risk, bone risk, brain health, all of those things. So it is a safe hormone to use in the judicious amounts that we're using it in most women. So,
Yeah.
yeah,
Yeah.
yeah.
Here's another myth. Women don't need testosterone replacement therapy after menopause.
Well, when do they need it? I mean, like if you don't need it
Right.
in menopause, when your levels are declining significantly, right? So we peak testosterone around our 20s, around 20 or so, and then we just have this gradual decline. And similar to estrogen and progesterone, perimenopause and menopause, testosterone really takes a dive then. And I can tell you clinically, most of patients come in saying like, I have no libido, or I don't care about sex anymore, or gosh, I really can't maintain my muscle mass no matter what I do. And those are the clinical signs and symptoms that testosterone is low and that we do need it. So again, I think it's this, a little bit of cultural bias that women as they age don't need to have, don't need to have their sass, don't need to have their vibe on, don't need to have sex anymore, don't need to want to have sex anymore, or don't need to want to have, muscle tone and energy. So yeah, obviously I completely disagree. I think women absolutely need estrogen, progesterone, and testosterone in menopause for sure.
Yeah, absolutely. Um, Another myth is women can get enough testosterone from estrogen replacement therapy.
Yeah, I think that is that's a good myth to talk about because um, e- estrogen, systemic estrogen does a really good job in promoting some sexual benefits. Local estrogen, obviously in the vagina, excuse me, will improve blood flow, lubrication, hydration. And many women will say, "Oh, I do feel better sexually on estrogen, not only local, but systemic, a patch, things like that." But most women will say to me, okay, I got a little bit of it, but I still don't have quite the drive. Like my libido's lacking. Like sex is a little bit more enjoyable. Maybe I think about it a little bit more. But testosterone is, to me, is sort of the icing on the cake to really address libido as well as muscle mass and energy levels. I've had a couple of patients lately that have been just a complete game changer to put them on testosterone. My way of treating is oftentimes if someone's new to menopausal hormone therapy, I will start them on estrogen and progesterone first, and I'll sort of optimize those hormones and then see how they feel systemically. Do you have good libido? Do you have your sass back? How are you feeling with hot flashes and sleep? Because a lot, as you know, Jill, right, our sexual function is not just our hormones. It's our lifestyle, it's our relationships, it's how tired we are, right? And a lot of middle-aged women, we're tired, we're doing a
Yeah.
lot. And so I think if we replace estrogen and progesterone, deal with lifestyle, get exercise in place, get nutrition in place, really optimize everything. And then I add testosterone. And then that's when women can say, okay, now I've kind of hit my optimum versus some women don't quite need it yet, testosterone. So we do the estrogen and progesterone first and the lifestyle, and then they feel pretty good. And then we add testosterone maybe a year later.
Yeah, I think that's so smart. And one other lab I would say to add, or a panel, is the thyroid panel, because in midlife,
Absolutely.
what is it? Like 1 out of every 10 women start to have thyroid disease. Now, I only have half a thyroid for the last 25 years, and that has greatly impacted my libido and my weight and my ability to feel that zest for life. So for me, optimizing my thyroid has always been front and center.
Yeah, excellent point, right? All of our hormones are so intricately related and
Yeah.
balanced. And then when we start hormone replacement therapy, we really do need to pay attention to the thyroid. Because if you're on thyroid medication, you're given estrogen, that can alter your need for that medication, right? For thyroid
Yeah.
replacement. You're so right. So all of these things, our sexual function is so multifactorial. I would say in men, but especially in women, it's very psychological. It's, all the components. So for addressing all the components, to my mind, testosterone is an important, vital role in that whole menu of things to offer women. But I do really like to get estrogen balanced first and their thyroid.
Yeah.
Yeah.
And speaking of a menu of items to offer patients, let's talk about the different forms of testosterone therapy. Now we know that there's no testosterone that's FDA approved for the use of low libido in women. It's not approved for women's use at all. But what can you tell us about the different forms of testosterone that one might be able to choose from?
Yeah, there are several different forms. And just to reiterate, none of them are FDA approved. And I think we could all get on a soapbox about the hypocrisy of that and our cultural influences about not having an option for women. Um, I typically use a compounded cream, and there's controversy around using compounding pharmacies and compounding creams, but I feel most comfortable with it because I can dose it appropriately. So what many people do, and it's a very reasonable option, is to prescribe off-label a male version, an FDA approved testosterone that's FDA approved for men. So the androgels, there's Testofen, all these other ones. So the problem I have with that is a woman is supposed to take a tenth of the dose
Yeah.
of one of these things. So as you know, it's like a foil packet or a pump, and you're just supposed to take a tenth of that. How do you measure that effectively? So that to me is a higher risk of giving women too much testosterone or not enough, but most often too much. And then they can become, side effects of mood changes and things like that. So I'm a little more conservative in the sense of wanting to dose more specifically. So to answer your question, there are injections. I think that's a reasonable option to use if a woman is not concerned about using a needle. You can do a sub-Q, which is in your, pinching up your
Mhm.
fat, or intramuscular, which it can be in your thigh or your buttocks or your arm. Those are effective. And again, you're using a tenth of the dose, what would be prescribed for a male. Um, if women like to do that, I do prescribe that. And that is often from a, regular pharmacy, or you can do a compounding pharmacy. And then the gels that we talked about, the FDA approved gels for men, creams. I don't know many people who are doing oral testosterone, just because similar to oral estrogen, there's this first pass effect in the liver. You're more likely
Mhm.
to have, poor side effects in terms of your lipids and other things. That there is some potential there. I think there's different forms of testosterone that pharmaceutical industries are investigating to be able to use an oral testosterone. But again, I stick with a compounded cream, and I start women anywhere between 2 and 4 milligrams, depending on their hormone levels and their symptoms. And then we gradually build from there.
Now, some doctors also compound testosterone alongside estrogen and maybe
Yeah.
progesterone too, even though I maybe you prefer micronized progesterone orally. But I have seen some, some of my clients come to me and they have it all wrapped in one. I'm not a doctor, I'm just a health coach, but my gut feeling is, well, then how do you know how much is working and isn't working when it's mixed with everything else? Like, especially if they start out of the gate like that. So
Right.
I like to keep things as separate as possible so you can sort of play with the ratios, at least in the beginning. What are your thoughts on that?
I completely agree, Jill. So I never put anybody, similar to how I just do this stepwise progression between estrogen and then the testosterone addition. I don't like to put everything in once until into one formula until we've determined the optimal level for that patient. So with perimenopause, that's very challenging, as you know, right? Hormones are
Yeah.
fluctuating all over the place. I find that probably nearly impossible to say, here's your formula, because it's going to change. And a postmenopausal woman, as let's say that she really likes Biest, which is, a estriol and estradiol non-FDA approved and compounded hormone regimen. And then she likes her testosterone, and we figure out those doses separately, then I'm happy to put that all in one combination to make her life easier. And then I am a fan of oral micronized progesterone just because of the, higher benefits on sleep and reducing anxiety and sort of that calming effect that I find is
Mhm.
a little bit more effective orally. So yes, I agree. And once a patient is established with me and we figure out the right dosing, eventually we could do that. But for now, I like to do my favorite regimen is honestly an estradiol patch, an oral progesterone, and then a testosterone cream.
Yeah, that's what I use. I don't think we can leave this conversation without bringing up pellets. Pellets are becoming more widely used by more functional medicine doctors. It's, we're cash paying anyway for testosterone, but this is
Right.
it can be an expensive routine to get into. And there's a lot of controversy over pellets. Now, I know women who love using pellets. I actually started using pellets maybe 10 years ago for the first 2 years, but my levels went so high. And we're going to talk, maybe now we open up the conversation to the pros and the cons to using pellets. And one of the cons is that if the level does become way too high and you are predisposed to hair loss and you are predisposed to high DHT levels, which I am both of those, it triggered loss that was so bad for me that I personally will never go back to them. But some women love the convenience.
Yeah, they are very convenient. And so this is how I approach most discussions with my patients in the office about hormones. Is it's a conversation, right? It's reviewing the risks and benefits, the pros and cons of
Yeah.
each of these, because pellets are incredibly convenient when they're dosed correctly. I have a similar experience where I tried pellets. It's probably been about 10 years, and I was probably a little early to try them anyway. But I I was angry and horny for 3 months. Like just the combination is not a great one for your
No.
marriage. So it just was not, it was a poor experience. But I do believe that for some women, they are a good option. And especially if you see a provider who is very, very well experienced in them. So they've seen, not only have they done the book study, but they have the clinical experience to say, okay, I've used this so many times. A typical patient like you, I'm pretty certain of this dose should work. But the downside, as you mentioned, is it's a commitment. You are committed to that for 3 months. You can't take
Yeah.
it out of your body. I found those 3 months very uncomfortable, very hard on my life. But I don't want to say pellets never, because I've had patients, friends, acquaintances who swear by them. So it's not my recommendation. I don't offer them. I don't recommend them, but I also would never say like no one should ever do them. But there are some potential high risks. I mean, you really do affect your life for a few months if you overshoot it, or if you undershoot it, then you've, wasted a fair amount of money too.
Yeah.
Yeah.
So you talked about dosing a little bit. I also want to talk about lab ranges. And this is
Mhm.
something a lot of women want to know. What is the optimal range? When do you know that you're too low? So, how do you handle that with your patients?
Yeah, I think labs are an interesting question just in general for all hormones, right? Thyroid, a lot of people will just do a TSH. That's not adequate in my mind. You need much more
Right.
data, like a free T4, a free T3. And similar to, estradiol, progesterone, and testosterone, and DHT and DHEA, like there's all these androgens that we can test for. And but we're not certain of what's normal. Like putting someone in a normal range is difficult. One, the data isn't great, I would say, about what's normal, what's abnormal. And then what type of testosterone testing are you doing? Are you doing an immunoassay, which may not be excuse me, my brain space for a minute, as accurate as, mass spectrometry, which is LC/MS, if you'll see that on a lab,
Hmm.
right? So that can detect much lower levels of testosterone, which is more appropriate for testing in a woman. It is more expensive. The other controversy is, do you test free testosterone? Do you test total testosterone? I always test sex hormone binding globulin. And not to get too biochemical, but just so your audience knows, sex hormone
Yeah.
binding globulin is a protein in our blood that binds our hormones, specifically our sex hormones. So there's different conditions that cause it to go up or down, like a birth control pill causes it to go up, which is it soaks up all that extra testosterone, which is why many women when they're on the birth control pill have no libido, right? So all of these things affect how we feel and what's going on in our body. I really rely on symptoms, honestly, more than labs. I will test labs. I absolutely to get a baseline, and then I test again about 4 to 6 weeks after I put someone on a testosterone, but it is really what she's telling me. So I have a woman who she might be on slightly higher range or above the normal range of free and total testosterone, but she feels amazing. I'm not going to lower her just to get her into that lab value. I mean, if she's, 2 or 3 times, super physiologic levels, right? But testing is important because you can determine other pathologies going on when you do testing. So I look at liver function tests, lipids,
Hmm.
glucose screening, insulin screening, a complete blood count, looking for anemia, looking for too much blood after testosterone use, things like that, too many red blood cells. So there are screening labs that I feel are very important before you put someone on any hormones, and then screening labs, 4 to 6 weeks later to see what their adjustments are, see what their hormones are like. But I really rely on their symptoms.
Yeah. So I think for some women, also just looking at the numbers, looking at the data to help them make that decision is also really important. It's like getting a CAT scan for your heart, right? If you're someone who might need a statin therapy because of bad genetics, poor family history, whatever it is, and your risk is increased, looking at a CAT scan you might say, "Oh, okay, that's not a great score,
Right.
and maybe I do need to make this decision for myself." And just like that, I think looking at lab ranges for women and really understanding. Also, there's just a lot of women out there who are really curious. My mind is very curious. I want to see in black and white, where am I? And correlate that with how I'm feeling. And then if I do try that therapy, how am I feeling and is that number? It's totally,
Exactly.
totally not necessary, but for some people, it might help move that dial for them.
Yeah, and I would argue, I agree with you completely. And I argue that it is a little necessary. I think for absolutely following afterwards, like what effect is this medication having on my body? So no one would start a thyroid medication and then never test the thyroid
Right.
level again, right? So it's counterintuitive to think that we should not test our estrogen and progesterone. And again, in conventional medicine, I was very heavily indoctrinated to never test hormones. They fluctuate so much. It doesn't matter. You can't read anything from it. I think that is absolutely changing. The more we study it, the more data we have. And to your point, I feel the same way as a patient. I want to know where I am and I want to correlate it with my symptoms. So
Yeah.
if I'm feeling a certain way, I actually have a standing lab order for myself at the hospital in my town where I can just go in and kind of check to see where I am because I'm in perimenopause still and I fluctuate. And I like to correlate it, be like, oh, wow, my estrogen really was up that day or what's going on. So, yes, I agree with you that it helps women understand their bodies. But I just want to emphasize that it's not black and white. And so
Right.
some practitioners and some patients really just look at that number and be like, okay, well, now we're going to adjust their hormones based on that number. And I'm not really listening to the patient and how she feels.
Yeah, exactly. I want to talk about two patient populations and testosterone. The first is cancer survivors. If
Mhm.
you've had breast cancer, for example, is there any contraindication that that woman should not be using testosterone?
It's a really interesting question, and that's, as you know, a very controversial subject of any hormone replacement in women who've had breast cancer. So it depends on the breast cancer. I feel like the women who have had triple negative, meaning they are hormone receptor negative, they don't, their cancer did not have estrogen or progesterone receptors. It's a little cleaner in terms of using hormones in those women, and I prescribe hormones for those women. And women who've had a breast cancer, depending on their type of breast cancer, the advanced stage of the breast cancer, estrogen and progesterone is much more controversial. Testosterone is less so. So there is good data in women who've had breast cancer that testosterone is helpful, especially if they're on aromatase inhibitor, they have no libido, they have other symptoms from those medications, that testosterone is not related to breast cancer, not related to recurrence, and can, in some literature, looks like it is protective of
Yeah.
breast cancer. So I feel very comfortable with testosterone in patients who've had breast cancer or at risk for breast cancer. And also I'm starting to be more interested in using estradiol and estriol in patients who've had a history of breast cancer in, conjunction with talking with their oncologist.
Yeah. And the
Yeah.
other patient population is the women who have had their ovaries removed or oophorectomy.
Yes. So there's such a huge difference. And we know this, theoretically, but when you see it in action in patients, as I do, so women who've had a surgical menopause, it is a much different beast than someone who goes through menopause naturally. These women tend to be younger, but not always. And the challenges are, I believe, much greater in terms of balancing their hormones because they're at a younger age. I have a patient right now who has a free testosterone level of 9, which is probably twice as much as normal. She's not on any testosterone. So it's hard to explain, like, what are her adrenal glands doing? What's her peripheral conversion doing, right? She doesn't need testosterone, but she's had significant issues with the lack of estrogen, even as we're replacing it. So it's just a different animal, and absolutely women in surgical menopause need testosterone and need it almost immediately with the estrogen,
Yeah.
progesterone, and testosterone.
Yeah, I've read a lot where doctors are supposed to start testosterone therapy right away, like the day
Yes.
of the surgery.
Right. And it's not even it, of course, our libido, our sexual health is a vital, important part of our life, but it's also their bone mass, their brain,
Right.
their mood, their energy. We didn't really talk much about that. I just want to highlight that is that, sexual function is incredibly important, but so is our energy levels and our mood. And I have women coming to me saying, testosterone was a game changer. Like, I have
Yeah.
energy again. I don't know how you are, Jill. I have to use my testosterone cream in the morning
Yeah,
because
so do I.
it energizes me. If I use it
Yep.
at night, I wake up at 4 o'clock in the morning, like
Yep.
just from it. So it is a mood enhancer and an energy booster for me personally.
I always say it's your zest for life hormone, right?
Yeah,
If you all of a sudden are feeling like really flat in life and like you're
right.
unmotivated and nothing sort of looks like it's in color anymore, chances are you're probably low in testosterone. And by the way, a lot of providers don't even test for testosterone
Or even talk about it,
or
right?
even
It's
talk
not
about
even
it.
talked about. So I think of estradiol and estrogen as our sassy hormone, and I think
Yeah.
of testosterone as our zesty hormone. It's just that energy. Like,
Yeah.
zesty gives you sort of the attitude, but testosterone gives you the energy to carry out the attitude
Yeah.
a lot of
Yeah.
ways.
And speaking
Yeah.
of bone health, in 2024, I was diagnosed with osteoporosis.
Oh, well.
And yeah, so it's obviously something genetic because I do all the
Right.
things and my lifestyle's pretty honed in. So for me, one of the first things my menopause specialist did was say, let's look at your testosterone levels and, maybe they are within range, but maybe we need to go above range just for more protection for your bones. And so right now I'm sort of on that journey. Can you speak to that for a bit?
Yeah, lots of data on testosterone and bone,
Yeah.
bone remodeling, supporting not only not losing more bone, but
Hmm.
promoting more bone growth. Same with estradiol. But testosterone is really important for bone. So I think I've had a couple of patients that we've done the same thing, that we've added a little more testosterone to support their bone health as well as a little bit estrogen. So I kind of run them on the higher side of both of those hormone ranges.
Hmm.
And we've seen improvement in their bone mass. So yes, I think bone and brain too. The data is a little more mixed on cognitive function. There's some benefit, but most of the data shows less than on mood. But again, the brain is so important as we age, and really good studies on frailty in older people and being placed on testosterone and have decreased frailty. So all of the
Yeah.
things, bone, brain, sexual health, all of it.
Yeah, so I went up in my dose, and this is where I think it's really important to talk about building your healthcare team. So I'm going to just circle back a minute and say that just because your doctor delivered all five of your babies or three babies, whatever you had, doesn't mean that they're your menopause specialist moving forward in life. And you have to figure that out for yourself. Um, for me, upping my testosterone, knowing that I am genetically predisposed to hair loss, knowing that I am genetically predisposed to DHT levels being high, and maybe you can speak about dihydrotestosterone and how that affects our hair follicles. For me, I also needed to bring in a derm who's very specialized in hair loss. And so for someone like me with half a thyroid and all of these other genetic
Right.
components going on, I had to, make a lot of decisions on certain medications. So for me, in terms of keeping my curls healthy and strong, I have to take oral minoxidil. I also take oral finasteride. So I can protect my bones by increasing my testosterone and protect my hair by taking two other medications. And someone listening might say, wow, that's a lot of medications. Plus, she's on, her thyroid medications. Yeah, this is what it takes for me in my health equation. Everybody's equation is different, but my priority is keeping my hair. It makes me feel good. And my priority is also keeping my bones strong and healthy. So I did make these decisions for myself. And a lot of women say, I just want to sort of age naturally. Well, if I took that attitude and age naturally, I literally would have, a third of the hair that I have now. I would not feel good about myself. I would have no libido, no strength. Like it just, my whole zest for life would be completely gone.
Right. Thank you for sharing all that, because it is so important for women to hear, for your listeners to hear, like, this is not, it's not like you said, you don't just take the testosterone and then you don't work out, or you don't, you don't eat healthy, like all of these components. And it's part, some people may argue, oh, it's vanity. It's not. I don't feel like it's vanity. It's your whole health. It's looking at your longevity, and it's feeling good. And to your point, most people feel good when they look good. Most people don't feel good if they're losing their hair, or
Right.
their skin's really dry, or they're just uncomfortable in their bodies. So I applaud all the things that you've done. And to your point, getting a healthcare team that's educated in this, right? So I was not the OBGYN to see 8 years ago at all. I didn't, similar to when I believe you're a little bit of a better OBGYN after you've had a baby. You're a little better of a
Mhm.
better OBGYN after you've gone through perimenopause and menopause. You really do have to understand this intricately. And there's plenty of amazing providers who haven't gone through perimenopause and menopause, and they're really good at their job. But it's a point of they've made it a focus. They've studied it, they've learned about it, they're treating patients frequently enough that they have that clinical experience. And yes, you need a derm. You might, for some of us, need a plastic surgeon. You just, all that, your care team does matter. You need an excellent
Right.
endocrinologist for your thyroid. So yes, all of these things do matter. And with the DHT, that's such a tricky thing. So it's not generally recommended in in certain, like, different expert bodies of, like, the Menopause Society and other ones, and Ishwish, to check DHT. I
Right.
do check it because I'm similar to you. I have a genetic predisposition to hair loss, and I think it's really important. And there's a significant rise in many of my patients. So, oral finasteride, or topical, is an option
Mhm.
for these women. Also, saw palmetto. I put a lot of women on saw palmetto to block that conversion of testosterone to DHT. Nettles, quercetin, chasteberry. There are herbs out there that can work. And then there's also the finasteride, the medications. And similar to testosterone, I do think women knowing about minoxidil, knowing about finasteride is really important, because we do have hair changes that aren't always reversed when we go on hormones.
Yeah. Now, finasteride for some women has been shown to lower their libido. That
Right.
hasn't been the case for me, but I have also increased my testosterone. And I also do a lot of other things. I think, we can talk about mindfulness for, the next 2 hours and how that plays a huge role in the connection with all of these things related to libido and sexual pleasure. But I want to jump over to the FDA that has two approved medications for low libido for women if women should choose not to go on testosterone. Can you tell us about Addie and Vyleesi?
So Addie, I had used when it first came out. I used it in a few patients, and I decided it wasn't something that I wanted to prescribe for
Hmm.
my patients. One is one, women aren't able to drink alcohol on it, and not that
Right.
I think women should drink a lot of alcohol, but for a lot of women they do drink alcohol, and so it's like this contraindication. It's not going to work as well. And also for some women, who sometimes depending on their relationship, maybe one alcoholic drink allows them to relax enough to consider sex and sexual activity, right? So I
Mhm.
just didn't like the fact that they were opposed to each other and we couldn't use them. And then the other one by Lisa, I have not had experience using, so I don't want to speak to it.
Okay, got it. Thank you. Let's talk about sexual wellness beyond testosterone and other modalities that exist. And one of those is red light therapy. I am a huge red light therapy proponent. I use a red light therapy cap for my hair growth. I sit in front of a red light therapy panel for my cellular function and mitochondrial health and wound healing, all the things,
Right.
my skin, um, every day. But there's also red light therapy for your vagina. And you happen to be a pioneer in this, and you are involved in Joylux. So tell us all about Joylux and the science that you have done to back this device up.
Yeah, thank you. Yeah, red light therapy is pretty amazing and it's very safe and it's been around forever. It was first used in the 1960s by NASA to accelerate wound healing and astronauts in space, which I think is really interesting and kind of one of those unique discoveries that, wow, we take it to space and look what it does with low oxygen levels. So as you spoke to, what red light therapy does is it stimulates our mitochondria to produce, cyclic AMP and more ATP, which leads to more production of collagen, elastin, and blood vessel formation. And we've actually done quite a few studies. Our first clinical study, well, let me talk about the device first. So, what Colette Cordian is the CEO of Joylux, and I was her doctor when she had her baby 10 years ago, and she had this brilliant idea of putting red light therapy in the vagina. She had a background in aesthetics, was using red light therapy and lasers on the face and ultrasound and technologies. And she said, why don't we put these things in the vagina to increase the collagen and elastin and also help with bladder issues as well. So she created this device. I actually have it here. So it looks like a
Mm-hmm.
vibrator, but it goes inside the vagina and you can see the really powerful red light therapy. Um, this is it. So quite
Mm-hmm.
powerful. So this is inserted into the vagina. You leave it there for variety 6 to 10 minutes, 3 times a week. And what our clinical trials looked at was bladder incontinence improvement as well as sexual function improvement. So the women used the device every other day for 8 weeks, excuse me, for 6 weeks, for 10 minutes, and they saw a 90% reduction in incontinence, a 90% improvement in sexual function. 100% of women felt more intimately close to their partner, and 93% had increased confidence sexually. So, and I can show you all that data. There's more data there, but what we found was that women really enjoyed using it and improved their confidence, but they also noted increased hydration, lubrication, and less pain with sex. So again, what the red light therapy does is it's stimulating those cells to produce blood vessel formation, collagen, and elastin. So yeah, I love red light therapy for the vagina. I use it as you do on my face and my hair as well, and it really does make a difference. So yeah, that's the Joylux story. And then Halle Berry joined us about a year ago and loves our product. She used it initially when she was having difficulty with intimacy and has, it's been a game changer for her as well.
So I have one too.
You
And
do? Oh, good.
I've had mine for like 3 years. Yeah, it's probably been about 3 years. And so there's an app on your phone that helps you program how
That's
to
right.
start slowly and move your way up to, how many minutes you're going to be using it. It gets you onto a weekly schedule, which is very helpful for women who have busy lives.
Yeah.
Um, it's not uncomfortable at all. I would lay in bed, lay on my back with my knees up a little bit, and that's how I would use it. There's a gel that comes with it. So, like
Right.
you said, you're inserting it in your vagina, but not dry, right? You're lubricating
No,
it to
we have
slide
a
right in.
photonic gel that comes with it that
Mhm.
actually amplifies the light and increases the
Yeah.
light percentage by about 40%. But to your point, it's this gentle heat. Got a nice
Yeah.
vibration. You can turn the vibration off if you don't like it. But vibration has also been shown to stimulate fibroblasts and elastin production. So it's the multimodality of the red light therapy, the warmth, and the vibration that create these changes in our tissue. And, it's very relaxing. And the app is so great because you can turn off and on the device through the app. You just program
Right.
it. And then there's lots of content on there. We have written a lot of content, blogs, stuff, anything to do with health and especially women's health in midlife. So you can
Yeah.
entertain yourself with the app and read while you're laying there as well.
Yeah.
Yeah.
Now, there's also in-office treatments such as lasers and different variations of that, which I
Right.
also did probably 10 years ago. My
Interesting.
functional medicine doctor, she brought in the first one into Illinois, and I was always sort of the guinea pig. And so she would do all these, complimentary treatments on me and come on, Jill, let's try this out. And so I did it for about 3 years and I really felt improvement. It is very expensive. There's pros and cons to it. It's not for everybody, but what I love about Joylux is that it's in your home. And I always, like I live in downtown Chicago and there's all these pop-up red light therapy studios going everywhere. And I say, for the money you're spending on that, invest in a panel in your home so that you have it at your fingertips. It's in your home. You don't have to leave your house to go make a point to have your 10, 20, 30-minute session, right? So you're going to be more compliant. So what other pros and cons could you think of
Yeah,
with?
those are good things to bring up. So the lasers in the office are very effective. I find them they're so lasers, lasers is this intense focus red light energy where an LED light or red light therapy is more of scattered energy. So it's less intense. Lasers are destructive in a way. You're actually hitting every other line of tissue in the vagina and just burning the tissue essentially, right? And coagulating it. And then the repair is what causes the improvement in the tissue healing, the collagen, the elastin. So there's downtime, there's a little bit of discomfort, discharge, things like that. Again, you have to make an appointment. It's expensive.
Right, right.
You need to go every year or so to keep up with those results. We did study the red light therapy, our VFit, in women who had had lasers. Dr. Alexis McCreen has studied this. She's a dermatologist in New York and an excellent physician. And you do get longer benefits if you use the red light therapy after a laser. So that's one thing to also consider is that if you use the VFit after a laser, then you're going to extend your benefits longer. So you need less of a, frequent treatment. The other thing about an at-home device is just sort of privacy. A lot of women tell me they don't really want to talk to their doctor that much about it. And of course, as an OBGYN, I want them to talk to their doctor about it. But if you're sort of like, oh, I'm having this, I don't really want to, I'm more of a private person, this is something that you can do in the privacy of your own home. Cost effectiveness, Colette and I have done cost analysis on this. So if you look at hormone replacement therapy, and when it's not covered by insurance, it's quite expensive. And even when it's covered by insurance, although I really encourage women to use local vaginal estrogen no matter what,
Yeah. Yeah.
but this can be used in conjunction with it. For incontinence, women who are using, adult diapers or pads, that's quite wasteful. It's quite irritating to the vaginal and vulvar tissue. So to me, that's not that's a Band-Aid. That's not an actual solution. And then again, lasers versus our device is much more cost effective. It's like $2 a day versus $8 a day over
Hmm.
the 2 years of use. So
Yeah.
cost effective home use, convenience of being at home, using it when you want to, and then just the comfort of that too.
It's portable. You can take it on vacation with you. A
Yeah,
lot of people these days go
absolutely.
rent Airbnbs for like a month at a time. So it's something that you can
Right,
take and stay compliant on, which I love too. I always talk about whatever equation you're coming up with, it's got to be as portable as possible, right?
right,
If you are someone who's practicing mindfulness, that's really portable. If you're someone who, is going through hair loss and you're wearing a red light therapy cap, you can pack that. It's portable.
right.
So that's really important to me as a health coach, really helping my clients stay compliant and having that continuum of whatever they're doing in their routine.
Right, and not having it be really onerous or difficult,
Yeah,
right? And we
exactly.
talked
Right.
about, with the medications and with these different things that we're doing, if you have it all accessible and you have yourself on a schedule and a routine, then you're much more
Yeah.
likely to continue these things and then get the benefits. It's when we try something, we go to the gym for a while, we give it up, we're not, it's helping us stick to a plan that allows us to be healthy, but it's just a matter of dedication, but also ease, right?
Right, because we're sitting here talking about, different forms of testosterone that you could use. And then, of course, you just mentioned vaginal estrogen. You can use inserts and a topical cream on your vulva. We're
Right.
talking about remembering to use your estrogen patch twice a week or whatever it is. We're talking about a lot of moving parts here. And a lot of women feel really overwhelmed, like, I don't want to be responsible for doing all this stuff. Well,
Right.
okay, that's a choice you have to make. But all I have to say as a health coach is the more that you do this in your routine, the more natural it becomes, the more intuitive it becomes. So in the beginning stages, all of these things, including using the Joylux red light therapy vaginal device, might be cumbersome. It might be something that you have to schedule in and it feels just awkward. But eventually you're going to have the buy-in because you're going to see the results. And then that intuition of this expanded routine for your own health and wellness is going to sort of settle in for
Right.
yourself.
Exactly. And then it's sort of just, it's similar to the basics of, healthy nutrition and exercise. If you stick to it long enough, you see, oh, wow, I have more muscle tone. Oh, wow, I have more energy. Oh, wow,
Mhm.
my skin looks better because I'm eating non-processed foods and lots of healthy fats, right? So you see the benefits. So it's worth it to do it. But to your point, you need a team of people around
Yeah.
you, someone to educate you, someone to hold you accountable, someone to prescribe for you. And you just have to build a really good healthcare team where you feel validated, seen, heard, and then personalized, right? Your regimen is personalized too, because everybody is different. And I like when you use the word equation. Like there's all these things that go into the equation for our health. And the components of a good healthcare team, whether it's hormone replacement therapy, red light therapy, any of this stuff, like does need to be personalized to you.
Yeah. I
Yeah.
think that's a great place to end our podcast. We have covered a lot of information here. Is there anything else on your mind regarding testosterone for women that you'd like to share?
I think just demand the conversation, right? Educate
Mm,
yourself, demand the conversation with your provider. If your provider is unable to have that conversation, find another provider. We now have, so many multi-state national providers that can prescribe these types of medications and talk to you about it. And then also the other component is just to emphasize testosterone is not a magic bullet. Sex is can be a complicated matter for many people, and investigating whether it's with a sex therapist, a psychologist, your gynecologist, like all the components that go into sexual wellness are really important to address.
yeah, well said.
Yeah.
Well, I will put all of your social media information on the show in the show notes. I know that you speak a lot on your Instagram profile about different hormones and applications. So I want to direct the community here to see all that you have to offer on social media too. Thank you so much again, Dr. Sierra, for joining me today on the Health Trip Podcast. I know there women are going to have many golden nuggets to walk away from.
Thanks, Jill, for having me. That was great.
Yeah, thank you. Thanks for joining.
Yeah.
Thank you for joining me. I hope you enjoyed the podcast. Lifestyle changes can be hard and overwhelming to make. By building your support team of functional medicine doctors, therapists, and health coaches, you can reach your optimal health goals. Be sure to check out my other podcasts. Until we meet again, stay healthy.